it's a few minutes past the hour, so I think I'm going to go ahead and get started. Hi, everyone, and thank you for joining our training today. I'm Amanda Hudgens with the Texas Association of Health Plans, and I've been managing the implementation of the CVO. Joining me on the line today are representatives from all 5 of our Star Plus plans, representatives from Aperture Credentialing, who administers the CVO here in Texas, and a representative from Availity, which is the portal housing our new facility credentialing application. And I also believe a few folks from HHSC are joining us on the line as well. But for the sake of time, I'm going to let everyone personally introduce themselves as they chime in or answer a question. But I would like to go ahead and introduce Bob Kalin from Molina Health Plan, who will be assisting me with presenting the information today. Just a few housekeeping items. As a reminder, please keep your phone on mute unless you're speaking, and please don't put us on hold. I do want to let everyone know that this webinar will be recorded and we'll be sharing the slides. They both will be posted on the THP website and the MCO websites, and I'm hoping I can get Veronica Neville's help with distributing these to the group as well. And additionally, we're aiming to end the call at 2:30 based on some conflicts that have arisen for our team, but again, it'll be recorded and you can reach out to me or any of the health plan provider relations teams with questions that we don't get to. And I'll also be updating our FAQ with questions that we received today, and we'll be distributing that as well. And I just wanted to let everyone know that during today's presentation, we will primarily be covering how to complete the facility credentialing application in the Availity portal, but if anyone needs the basic CVO overview, we have several presentations and webinars posted on both the TAHP and HHSC's website, and it should be on the plan websites as well. But if anybody still needs that info, I'm happy to connect with you and set up whatever conversations or training that you guys need. And just to get started, as we mentioned in the nursing facility FAQ that was distributed recently, I just want to reiterate again that no newly credentialing nursing facility needs to worry about taking any action during the month of April. And you will receive a letter from Aperture when you're required to take any action regarding credentialing. And also in that FAQ, we ask that nursing facilities perform a self-assessment during the month of April to determine if you're already credentialed with your Star Plus MCOs through MMP or Medicare Advantage contracts. But with that being said, the MCOs will be sending notifications letting you know either way during the month of May. And all of those letters from each plan will contain the same language just so we can minimize any confusion that might come from that. But if the answer is yes, you are already credentialed, you'll be deemed credentialed by those respective MCOs and will not be required to go through the credentialing process at this time. And again, any provider who will need to become credentialed will receive a letter from Aperture with instructions on how to begin the process starting in the month of May. And so do any of the plans have any other opening remarks or anything I missed that they would like to add just during the introduction? Okay, so Laura, Nina, I think we're ready to start moving through the slides. Okay, so the first slide is just really giving some basic information through the Availity portal. And Michelle, if I'm missing anything, please feel free to chime in and let me know. But essentially, the portal allows you to store information and submit it to multiple payers. It's contained within one website. You have one login, and it's a secure, compliant network, and there's no cost to the providers for using the portal. And this is just a screenshot of their kind of front page website that you guys will see. And in order to use the portal, you will need to be registered. And this slide is just walking through the steps to become registered. You're going to go to www.availity.com and select register in the top right of the page. And then you're going to select providers as your registration type, and then you'll start completing the registration process. It'll just take you through slide by slide. And then this slide is an overview of the information you'll need to register. You'll need just basic information that you're seeing on this little screenshot, your address, essentially, things that you guys are used to filling in already. You'll need an individual email address, a tax ID, and your MPI unless you're exempt. And so when you're logging in for the first time, you'll go to the same website, Availity.com, and this time you'll click Login at the top right of the page. And you'll use a temporary password that's going to be provided to you. And then the next steps are that you set 3 security questions and answers, and then you enter and re-enter your new password. And this slide is just walking us through the steps of the initial credentialing process. So first, you will need to contact your MCO to join the network. And once you've done that, the MCO is going to notify Aperture to start the credentialing verification process. And then Aperture sends the instructions to the provider, in this case nursing facility, to submit the credentialing application. And then you all are going to submit your application through the Availity portal. And then Aperture processes the primary source verification of the credentialing application. And then the MCO reviews those credentialing results, and then they contact you and notify you of the results. And again, this information, I'm sorry. I don't know if I need to go through this again, but this information at the bottom here is really essentially what I went through at the beginning of the presentation. But essentially, if you're already credentialed with your contracted MCOs as a skilled nursing facility, you're going to be deemed credentialed for those MCOs. And again, you're going to get a notice either way. And if you've not previously been credentialed as a skilled nursing facility, you will have to complete the application as an initial credentialing provider. And we also just wanted everyone to note that any change of ownership requires a new contract with the MCO, and you'll also be considered an initial credentialing event, and you'll have to fill out the initial credentialing application. And then the re-credentialing process is essentially the same. Nursing facilities that are already credentialed as a SNF with their contracted MCO are required to re-credential every 3 years, as you all know. Some of you have gone through this process before. And some nursing facilities may need to be re-credentialed based upon their skilled nursing facility credentialing date with their Medicaid MCOs. And these dates are going to vary by MCO, but moving forward, the earliest re-credentialing due date with any plan is going to be your new single credentialing date moving forward for all plans. And then I think, so Bob, are you on the line?
Yes, I'm here.
And so I think I was hoping that you would be willing to start with this slide. Are you comfortable moving forward at this point? And we
Sure.
also have Michelle here if you would like her to walk through anything as well.
Okay. Sure. So obviously this is the slide where you're actually going to start your credentialing process by selecting provider credentialing. So it's pretty straightforward. This is all still setting up your credentialing roles. So you're going to have an administrator for your credentialing for your account, and then you can assign roles based on other people in your organization. So for facilities that are multi-chain, the administrator might be at your corporate level with some administrative rights assigned out to facilities, or if you're doing it at a facility level, whoever's that administrator of the account can assign out different roles. These are just some tips for completing that application. All the fields are required unless it's stated that it's optional. You can click the continue or save to move forward. And then the documents that you're going to need to complete an application so that you have them together is you're going to need a copy of your license. You're going to need your insurance certificate if it's applicable. You need your most recent survey, so you need your 2567, and you want a 2567 that has the plan of correction on it. You also need to have all of the HHSC cover letters that go with that 2567. So you're going to have the cover letter that goes with that and your report of contact. And you're also going to need either your clinical laboratory improvement amendments to your CLIA or your CLIA waiver. So you'll need all of those documents to be able to attach within the application. So you need those in electronic formats as a scan to be able to attach. So it starts off with basic information. And the real beauty of all this is that you're going to complete this application once, and it's going to get routed out to all of the plans that you indicate you wanted it routed out to of the Star Plus MCOs. This doesn't work for any other commercial products. This is this time strictly for the Star Plus MCOs. If you put in the NPI may, if they've already got anything in their record, it's going to pull up and populate some of the fields for you. But you also need to make sure that when you put in that NPI, that the information that pulls up is current ownership information, because when there is a change of ownership, the NPI does always change. So you need to verify that that NPI is associated with your correct or your current ownership. As you're going down, you're going to have to select a specialty. Because this credentialing is all related to Star Plus, you're going to use as your primary the 313, which is the nursing facility custodial. If you are also providing skilled or want to be credentialed for skilled, you can put that taxonomy in the secondary box. And again, there's drop-down boxes that you can choose that from. So general information, you're going to fill that in. It's, business name, things like that, legal name. Make sure that however you enter this information, it matches the name and the tax ID on your W-9. So we need to make sure the W-9 that you're submitting ties directly back into the names that you're putting down as the facility ownership. You're going to use your Medicaid contract number. As the box indicates, you're not going to have additional Medicaid numbers for your Star Plus. It's just your one Medicaid number. And then you're going to complete the application using the various drop-down boxes. And there's a lot of questions that are pretty simple to answer as you go through those. So one of these sections includes insurance coverage. Insurance coverage is not required for Star Plus credentialing, but if you have it, it's recommended that you go ahead and submit it. If you're also looking to be credentialed for a MMP or a Medicare Advantage product with your skilled services, insurance is frequently required by the MCOs for accreditation for MMP or Medicare Advantage. You really need to check with your individual MCOs on what their credentialing requirements are for skilled, because each MCO can have different credentialing requirements for that. Versus Star Plus, we all have the same credentialing requirements as mandated by HHSC. When it comes to the business contact, be sure that you're putting in the business contact that is going to be the point of contact for the MCOs. So it needs to be somebody who is knowledgeable about the credentialing process and also has knowledge about what's in the application. And who that business contact is really your decision. It doesn't matter to the MCOs. It's really your decision of who that contact is going to be, but they need to be knowledgeable about the application. They need to be knowledgeable about the documents that are attached within your application, because they will be the person contacted if there are questions. They'll also be the person who's going to be notified when it's time for re-credentialing. So under the section of service locations, there's lots of different areas there. you're only going to select the items that apply to the nursing facility. And these are just informational questions. They're not impacting your credentialing status. So, you know, if you don't offer language interpretation, that's not going to any way impede you from being credentialed. It's really just getting what type of services are available. Again, some of these may or may not apply to you. Only select the ones that do, but it will not impact your credentialing status for STAR+. And this just continues through with those service location questions. Any questions, again, that aren't applicable to you, you're going to go ahead and skip those. And select only services that the facility is providing directly, not necessarily through an ancillary provider. So, you know, when it talks about radiology, even though you have some type of mobile x-ray coming into your building, you're not actually providing that service. The service is actually being provided by a different, by an x-ray provider. So you really want to make sure it's only the services that you provide directly, not those that you're also making sure residents receive through an ancillary provider. There's a couple of questions in there that are boxed for you. Those actually do not apply to nursing facilities, so you really don't need to worry, again, about completing anything in those. Those don't apply to nursing facilities. We highlighted that for you. So STAR+ credentialing requirements require the facility either have a clinical laboratory improvement amendment, a CLIA, or a CLIA waiver. Typically, nursing facilities all have CLIA waivers. A copy of your CLIA waiver is going to be required. If it's a nursing facility that's undergone a change of ownership, then the nursing facility will have 84 days to submit the CLIA from the point that they submitted the application for credentialing. So if you've gone through CHOW, you may not have your CLIA waiver back at the point you're filling out your credentialing app, but you will have 84 days from the point that you've done that application to submit that CLIA waiver. So when the section about licenses, you have to have a current nursing facility license under the current ownership that's being credentialed. So if you've had a change of ownership, you cannot submit the license that belongs to the prior owner. It must be the current license, current ownership. If you're going through CHOW, sometimes it takes a little while to get your new license. You're going to have to wait to submit that license until you receive it from the state. And applications will not be considered complete unless they have that license with it. There have been some cases where HHSC has provided letters verifying the facility has a current license. If you have a letter like that, that would be acceptable. Otherwise, we'll have to have that current license. So going through CHOW, it may take 60 days till you get your license. You're going to have to wait to complete your application so you have that license. So there are several questions about disclosures. Each of those questions need to be answered based upon your current ownership. So you need to make sure you read through those carefully. And anything that you answer yes to is going to require further explanation. So you'll have a text box that will appear, and it has up to a 500-character capacity. And if you need even more room, you can always submit it as a separate document. But an example is the question regarding whether or not your facility has ever had license revoked, suspended, sanctioned, subject to probation. So when you answer that question, if in fact your facility has ever had, or in your last 3 years have had Texas administrative penalties or CMPs of any type or denial of payment, those are all considered sanctions. So you would need to list those out. So we gave an example there of, you know, a facility that had Texas administrative penalties, you know, CMPs, as well as the DPNA. So you just really need to list out the details of what those sanctions were, because those are considered sanctions. Well, it's not a revocation or a loss of license, those are considered sanctions. So this is going into attach your CLIA waiver. Again, you're going to have that CLIA waiver, and you have your 84 days. Any files that you need to attach, they can be in a format of a JPEG, a TIFF, or a PDF, and there's no size limit to that file. So when you're looking at maybe your 2567 and it's 87 pages long, it really doesn't matter. The entire file can be uploaded into the system. It doesn't have any kind of limits on the file size. So there's some optional attachments as well. So while state license is actually listed as optional, it really is required. So we need the current license. Again, insurance is not required, but it's preferred. And again, it goes back to if you're also trying to get SNF credentialing or for NNP or Medicare Advantage with that particular plan, they may be requiring it. So if you do have it, please attach it. And then your 2567, again, we want to make sure it's one that has the plan of corrections, all the HHSC cover letters accompanying it, any clearance letter, and that is actually going to provide us the proof that you have your contract with Medicare and with Medicaid, because you have that 2567 that states that, and it's particularly stated within your cover letter. So that's the importance of making sure we have a complete packet there with cover letters as well as the 2567. The questions about the TMHP Medicaid letter and evidence agreement with HHSC, when you attach, again, that 2567 and all those cover letters, that's going to really support those two questions. So you don't need to resubmit that. If you've submitted it once, it's already in there, and that can be used as documentation to support those questions. Again, the current W-9, and again, we're going back to wanting that 2567. And you only, again, need to attach the 2567 once because it's going to support all of those other things. And if you'll notice some of these, like there was a question, if we can go back one or two slides there. Go back one more, please. It says attach facility organizational chart, attach DEA certificate. Those don't apply to nursing facilities, so you don't have to submit those. Okay, then we go into attestation. The attestation, you need to read through it, and the attestation to be signed by any authorized representative of the nursing facility. You're going to determine who is authorized to sign for the nursing facility, whether that be at a corporate level, whether that be the administrator, whoever it is that the facility or the company determines is authorized to sign is the one who can sign off on these. You can also print a copy of the attestation for your records. Make sure that you're checking off the boxes that you acknowledge and agree with the statement. So make sure you're checking off those boxes so it sticks. But again, it's your decision on who is that authorized representative. The credentialing dashboard, I'm going to hand that back to Amanda. We have Amanda?
Yes, thank you. Yes,
okay.
Thanks, Bob. Yes, in this slide, and Michelle, please chime in if I'm missing anything, but essentially this dashboard basically shows the status of your application. So as these talking points note, the statuses are color-coded, and any application with gray has been started but not submitted. Blue means the application has been submitted and is in progress. Red means an error was found, and green means the application has been approved. And you can go through and expand sections to view the progress and history details. And you can go in and amend applications that are in progress or with errors, and you can re-credential with approved providers. And again, this is just showing a little bit more detail of the credentialing dashboard. You can show or hide the progress of an application, and you can show or hide the details of any application. And so that's it for us. And I see some questions are coming in through the chat box, but if anyone has questions, I guess if you want to go ahead and ask them, and then we can try and get through as many questions that have come in through the chat box. I think we can just work through it that way. And just again, and I'm sorry, just before I get started with questions, I just want to reiterate once more that we are recording the webinar, and we will be sharing this with you all. It'll be posted on the TAHP website, and I'm hoping HSC will help us distribute it as well. And I'll also be updating the FAQ with any questions that we have coming in. So that will all be available to everyone. I just want to make sure you're all aware, but go ahead with the questions.
Hello, Amanda. This is Cynthia West, and I'm calling in reference. I'm actually wanting to ask a couple of questions in reference to the presentation, which was very, very excellent. One of the things I wanted to know, since the administrator has control of who actually has access to this actual database, will they also be able to remove anyone who is leaving their company? Like if they are no longer there, will they have the capability of removing them? That's question number one. And then question number two, I noticed on your sanction question, you said that it was within the 3-year timeline, but I don't see that indicated in that question. So I'm wondering, is there any disclaimer that says that the sanction must be within the 3-year timeline or ever? Is there anything that shows that?
I don't think we specify out to 3 years on the within the PowerPoint, but because facilities re-credential every 3 years, it is a 3-year time frame.
Okay, thank you.
And then Michelle, could you also help with the question she had first about, I guess, access for her team?
Absolutely. Good afternoon. Great question. You will have the capability from an admin perspective to add and delete users. So you will have that capability.
Great. And one more question. I thought that was my last question. For the recred portion, I noticed at the last PowerPoint slide, it says, or more, I guess it's more so towards the end of the slide, it indicated that you will have the capability of re-credentialing the approved providers on the credentialing dashboard. So if a provider is due for re-credentialing, will that administrator have the capability, or will Availity be doing that to actually filter them through the recred process?
Michelle, are you able to help with that question as well?
Sure. Great question again. We will help you with that recred date. We will notify you 120, 90, 60, and 30 days out so that you're able to come into the application and re-credential.
Great.
So,
That's great.
and this is Laura Malloy with Aperture. Yeah, you will receive a notification as well from Aperture that it's time for re-credentialing, and then you can begin that process.
So will the provider receive notification via email as well as mail, or just one or the other?
No, you will receive a letter by mail indicating that it's time for re-credentialing.
Hello, this is DJ Stapleton. I have a couple questions. One is I've received several requests today from Aperture for United re-credentialing. However, it does have the old United credentialing packet in, so I'm sent from this conversation we had today, it appears that we're still using the old applications in April, and then in May it changes over to the new. However, with Superior is sending me the new recredentialing applications with directions to send it directly back to them, and it isn't coming through Aperture. Should I be completing these or not?
That is a really good question. And you know, we may actually have to take that offline if that's okay, because I'm not. Is there someone on with Superior that might be able to speak to why that could be happening?
Yeah, this is Verna. If you received a notification of a recredentialing from Superior, it would have been it should have been one for prior to September 1. So is your due date prior to September 1?
I just received them in the last couple of days, so I don't know. They just told me I had to have it within 10 days to them. And to send it directly back to 2 different individuals at Superior for credentialing.
Okay.
And this is my first notice.
August. It's probably for August then. We sent those out beginning of first, second week of April. So yes, those need to be submitted. Aperture's processes began for facilities with the September recredentialing.
Okay, so I can still use the old credentialing packet then for those?
Correct.
Okay, perfect. Thank you.
You're very welcome.
Hi, this is Christine O'Brien. I have a question. If we, from what I understand, is if we get the Aperture, we have to get the Aperture notice before we do the recredentialing, and then like they need to notify us, and then we do the recredentialing. Because I have Availity access, and I cannot. There's no provider credentialing on my thing yet.
Yes, that's correct. We're actually asking that everyone wait until they receive a notification from Aperture to begin the process. The system really just isn't set up for providers to start, you know, entering in any information early. And so, yes, the best thing to do is just wait until you receive a notification from Aperture, and you're going to have plenty of time to submit the information that's required.
Okay, perfect. And then also, this is for SNFs, not just NIFs, right?
The requirement, yes, you can, that's where you're selecting the taxonomy. You know, the requirement for credentialing is coming underneath the Star Plus contract and the regs that go along with that. So that's where your taxonomy of 313. But if you are also asking the plan to credential you for skilled, you would choose that as a secondary, but you also need to make sure that you know what the credentialing requirements are for the various MCOs for skilled, as again, each MCO could have some different requirements underneath their skilled credentialing. This is really aimed at making sure everyone is covered for Star Plus, but it can be used for the skilled as well. But you need to check with your MCOs what their requirements are for skilled.
Okay, perfect. Thanks.
This is DJ Stapleton. One more question, since no one else had one. For those of us who will be doing the paper submissions and having to send those into Aperture, will Aperture then send them to Availity, or how are those documents going to be housed going forward for the other MCOs?
So,
Laura?
yeah, do you want me to take that? Sure. So this is Laura. If you send in paper, then we will utilize that paper application. We won't need to send it to Availity. We'll actually take it here at Aperture and utilize it.
But will it be available then for all the other MCOs? Will they know that it's available? Okay, that's what I was worried about if it wasn't online. So if it's going to be available that way, Good deal. Thank you.
Yes, if it's a re-credentialing event and you participate with several other health plans, we would use that paper application, yes.
Perfect.
Are there any other questions? If not, I can start. There are a couple that came in through the chat box that I have not gotten to answer. One of them is, how long will data be stored as current? And I'm not sure, Michelle, is that something that you could help with?
Yes, Amanda, thank you for the question. We keep that information on file so that it helps with the re-credentialing process.
Okay. Okay, thank you. Does that help? Hopefully that helps answer the question. And then we've had someone ask, our company does credentialing for many providers. Will we be able to sign up for Availity for each provider? And I believe the answer is yes.
Absolutely.
Yes. And then we had someone ask, will the entire credentialing packet be loaded for all provider types, or just the information required for NFs, to limit confusion on what is actually needed for the nursing facility to complete? And Laura and anyone else chime in, but you'll only be required to enter the information required for nursing facilities, which is what Bob just walked us through. You won't be required to, yes.
And there may be a couple of questions, there may be a few questions that don't apply to every facility, but because the fact that there may be a facility that is hospital-based, there may be questions that are included, like one of them says, is there emergency room services? Well, obviously, if it's a hospital-based facility, those would be available in there. So while it is aimed at nursing facility, there may be some questions that's really covering the whole broad spectrum that of all different types of based nursing facilities, whether they're freestanding, independent, hospital-based, et cetera. So the question, again, doesn't apply to your particular facility. You would move on for that, and that's really underneath that one section. Again, those questions do not impact your credentialing status.
Thank you.
And then I have one more question about what he just said. If we share the tax ID and we have different MPIs, we will be able to distinguish between each MPI under that one tax ID, correct?
I believe that's an Availity question.
I'm sorry, the question was if you have one tax ID with multiple MPIs, is that correct?
Yes, ma'am, that's correct.
Okay, yes, you can submit that application for that particular 10, but keeping in mind each individual physician or MPI or practitioner tied or facility tied to that 10 will have to have that additional information credentialed. And again, Laura, Mina, and Amanda, and Bob, correct me if I'm wrong, but from an application perspective, we're able to collect that data.
So I have to submit that, or?
Well, if you're only going to submitting, you're only going to credential your facility. So if you're, for instance, a facility that's owned by Dallas County Hospital. Dallas County Hospital is your 10, but they may have associated nursing facilities with 5 different companies. So really, you're going to have a conversation with Dallas County Hospital about who is going to do our credentialing. Is it going through Dallas County Hospital, or is it going to be at your facility level? So those are really operational issues that the nursing facility and your ownership needs to determine. At the end of the day, it comes back down to the 10 and the NPI. And if we don't have the 10 and the NPI and the credentialing application that goes with that NPI, then you would not be able to get that facility credentialed. But in terms of process of who's doing it between those ownership and operator, that really goes back to an operational decision for you all.
Okay.
Will the nursing facility have to complete an application for each MCO, or once they've registered with Availity and completed one application, they're credentialed for all the MCOs?
Amanda, Bob?
I was going to say, as you're filling out the application, there's actually a box that asks you which MCOs would you like your information shared with. You select whichever MCOs that you have Medicaid Star Plus contracts with. So if you have Medicaid Star Plus contracts with all 5 MCOs, then when that drop-down box hits, you pick all 5 of those. If you only have it with 3, you can pick those 3. So and then the application is filled out once, but the individual credentialing will be determined by the individual MCO. So you'll get notice from each individual MCO of what your status is with them in terms of credentialing. So it's one application, but you'll get, if you filled out 5, you're going to get 5 responses back.
The same thing for if something is missing, you'll get 5 notifications from each MCO, or is the intake process separate for missing documents?
So this is Laura with Aperture. You would receive one outreach from Aperture if there was missing information on behalf of the respective MCOs. Does that answer your question?
Yes, thank you.
You're welcome.
And it looks like we have another question on the chat. It says, if I'm an assistant entering the recred data, will I be able to save the data in Availity until the company official can log in separately to sign the attestation?
Amanda?
And yes.
This is Michelle. Do you want me to take that one?
Yes, that would be great.
Perfect. And again, another great question, Christina. We do have that opportunity to allow you to save and continue throughout the application process. When you get to the attestation piece, you're able to save it until the individual that you have deemed the attestation individual, you can save it until that individual is ready to attest. So any given point in time in the application process, you are able to save and continue and come back to where you left off. Does that answer the question, Christina?
Yes, that did. Thank you so much.
Perfect.
Thank you.
And another question that came in is just asking about CAQH and how it comes into play for nursing facilities. And the answer is that at this point in time, CAQH doesn't have the functionality to house the facility application. So if you would like to fill out the application online, you'll have to use the Availity portal at this time. But practitioners are still welcome to use CAQH if that's what they're currently utilizing. So are there any other questions? Okay, well,
Yeah, so
I
I have one more question, I think you answered it, and I apologize if you already have. So the facilities have to wait to get a notification from Availity before they can go in and start the application process. Is that correct?
This is
I'm sorry.
Aperture. The letter will actually come from Aperture and will give you instructions on how to access Availity.
Okay. All right. Thank you.
You're welcome.
Will there also be a paper application with that in case somebody can't go online, like the authorized official go online and sign? Can we have a paper application so we can get that signed instead?
You can certainly call and request that. We have our customer service number on the letter, and we can send it to you.
The MCO is communicating to Aperture what facilities need to be credentialed. That's how you know when to send who to send the letters to?
Yes, that's correct.
Okay. Okay. All right. Thank you.
You're welcome.
And then we have a question coming in. We are hospital-based, so when asked about X-ray availability, do I say yes, since they're connected to the hospital? I don't know. Is there anyone on the, we may have to send an answer to that later. I don't know if anyone on the line has an answer at this time. Well, we'll definitely look into that and get back to you.
If that service is provided under the same tax ID and NPI, then it would be yes, because you're actually providing this service.
Okay. Okay. Thank you, Bob, and we'll add that to our FAQ. Okay. Well, thank you, everyone.
Amanda, there's one more.
Yes.
There's one more question that just popped up on the chat box, asking if you submit an application online, and then for the next credentialing application, can you build from the information already entered into Availity?
Oh, yes. Sorry, I missed that. Yes. And the answer is yes. The information that you previously entered will be saved in the Availity system. So you shouldn't have to re-enter all of the initial information that you have to provide.
Hi, Amanda. This is Veronica. That was my question. And so then if you submit a paper application, does that information get entered into Availity, or with a paper application, would you have to resubmit all of the information again come the next re-credentialing?
Well, I believe that I think the answer is that it will be submitted into Availity, but if you choose to go the paper route and you don't want to sign up for Availity and enter your information there, and you want to continue using paper, you will have to fill out the entire paper application each time. Is that correct, Laura?
Yes, that's correct, Amanda. Each time it would need to be completed, or you could enter your data in Availity, which would be saved, and then you would just update it as required for changes.
Yeah, and so we're strongly encouraging you all to utilize the Availity portal. I think it'll make your lives a lot easier. But again, you know, it is a choice. It's optional, but you know, part of this entire initiative is to kind of save you some time on some paperwork. So.
Well, Amanda, to that point, I think it may be a little labor intensive up front to put everything through the portal, but when it comes time for re-credentialing, you're going to have some of that information already pre-populated. It'll be a review process, and then you're just making additional changes and submitting your new documentation, like a new license at that time. So it's, you know, invest a little bit of time now to make the rest of your life of credentialing a little bit easier, or you're going to be doing full paper applications every 3 years.
Yes, thank you, Bob. Okay. So it doesn't look like there are other questions, but you guys are welcome to reach out to me, or if you're communicating with Veronica at HHSC, we coordinate a lot. So submit your questions to either of us or your MCO provider relations team, and again, we'll be sharing this presentation and posting it and sending that information to you all soon. So thank you again, and hope you have a great rest of your afternoon.
Thank you, Amanda.
Thank you.
Thank you.
Thank you.
I know, Lizzie, right?